let's get started. My name is Jen Cool. I'm the Network and Engagement Lead with the Global Climate and Health Alliance, and I'm really delighted to be here today and so grateful to Malaria No More for hosting this session. It's been really wonderful to connect again with the Forecasting Healthy Futures community and the broader community to talk about the year ahead. With that, I'm going to turn it over to Kelly from Malaria No More to just say a couple words to start us off.
Good morning, everyone. I'm great to see such great engagement for this session. My name is Kelly Willis. I'm the Managing Director of Strategic Initiatives at Malaria No More, and I've been heading up the Forecasting Healthy Futures program for the last couple of years. Forecasting Healthy Futures, of course, has been working for several years now, working to generate more visibility for the impact of climate change on human health. And we're just thrilled to see the traction out there and a real groundswell of recognition that the global health sector not only has an opportunity to contribute on the mitigation side of the climate change challenge, which is an existential one for all of us, obviously, but really also can work to provide investable solutions that can help to reduce the impact that climate change is having on health systems around the world, which we're seeing more and more and are becoming just impossible to ignore. So when we convened our global summit in March, we really feel like we turned a corner. We helped turn a corner with the help of a vast array of partners like yourselves, and with the support of the COP28 presidency. We're thrilled to see a health day on the agenda for COP this year, and we're working actively to make the most of that through a series of events intended to highlight pockets of innovation we're seeing and really work to make a compelling case that climate adaptation funds are best invested in health. With all of your help, we hope that health can become a permanent fixture in the climate conversation. And a big part of that is having all stakeholders on the same page in terms of where most conversation is needed, what policies and priorities need to be emphasized at the UNFCCC tables, and where we all need to lean in on promising interventions that can save millions of lives in the face of such a major threat. We're mostly grateful to GCHA, who, of course, has been doing this for a lot longer than we've been involved, and is such an important voice and heading up some really important activities for the Health Steering Committee of the COP28 team, and helping to prepare all of us to be most impactful at COP is a big part of the value that GCHA adds. And so we're thrilled that we were able to kind of extend the reach and make this session available to more stakeholders, and I hope all of you will find it as helpful as those of us who've already been through the session have. So thanks so much again, and back over to you, Jen.
Thanks so much, Kelly, both for your very kind words about GCHA and also for kind of setting the scene for the year for us. Okay, so we're about to do a really deep dive into the UNFCCC and into COP specifically. And this, as Kelly noted, we have a really unique opportunity this year in that we have a COP presidency who's very interested in talking about health. And so GCHA has frequently done orientation sessions to help the health community who's coming to the COP meetings be prepared to engage, to understand the process better. But this year, given this very unique shift in the agenda and the presidency's focus on health, we decided to start running these orientation prep sessions a little bit earlier than usual to give ourselves as a health community as much lead up as possible to get ready for COP this year. And again, thanks to Malaria No More and Forecasting Healthy Futures for helping us spread the word about, bring people into the conversation. So the plan for today is I'm going to give a bit of history and context for COP and the UNFCCC. We're going to take a moment to talk about national plans in the international context. So the COP meetings are big international meetings, but there are national parts or national features that go along with them. Then we're going to talk through in pretty intense detail what happens at a COP. We'll talk a little bit about finance, and then we'll finish our conversation by talking through what does it mean for health, all of the context and background we've talked through. So as I said, we're doing a pretty deep dive into the COP space, but before we do that, I wanted to give a little bit of context about some of the things that we are thinking about it related to health, the intersections of health and climate change this year. I called them priority climate actions, but they're also sort of they're almost a mission statement. So health actors should be active collaborators in planning for a climate safe future. So lots of decisions at many levels of government are being made in response to the climate crisis. And whether at the local level, where city planners and transportation ministers and energy ministers are considering how to build cities that will be resilient in the face of extreme weather events or increased heat patterns, or whether it's at the international level, figuring out what are we all doing together to stop the climate crisis. There are ways that actions to address climate change, both mitigation and adaptation, can protect health in major ways. So using that city example, we know that there are ways that active transportation can make it easier to walk around cities, walk or roll around cities, which in turn improves health and reduces emissions, but you're also getting that really active transport benefit. There's ways to think through cooling technologies and also cooling systems, like putting more trees in cities to reduce the heat. All of those things can improve health, but they don't necessarily improve health. So we think it's really important that health actors be in those conversations from the beginning, so that that all actions that are taken to address climate change are also promoting and protecting the health of people. Another priority and sort of mission statement we're making is that fossil fuel phase out is crucial to stopping climate change and improving health. And a swift, just transition to clean energy will deliver health and equity benefits. So not only is fossil fuel phase out the only way that we're going to keep warming below 1.5 degrees, which is the temperature at which we start to see more extreme health impacts, there are major health gains to be made from reducing fossil fuel related air pollution. So traffic related air pollution, for example, has been shown to have respiratory and cardiovascular consequences. And so reducing the pollution that's in cities will have long-term benefits for health. It's also, we have to be really mindful that people need to be able to heat their homes. They need to have electricity to be able to see at night. I often, when I think of this example, I think about kids who just want to study and who desperately need to be able to turn on the light at night to be able to do that. So as we think about phasing out fossil fuels, we also have to be really thoughtful about how we ensure that communities around the world have access to the energy they need to heat and light their homes, to run the appliances they would need to run to keep themselves healthy, like air conditioners, and to be making sure that when we do that, we're not sidling parts of the world with polluting or health harming technology. So we don't want to have people, even as we're trying to get people away from burning charcoal, moving them on. Burning gas has also been shown to have health consequences. So let's not sidle people who are just getting electricity or just getting heating in their homes through something like gas. Let's not saddle them with things that we know have health impacts. Something that might be more familiar to folks on this call, we need to transform health systems so that they're low emission and climate resilient. Whether this means making sure that health facilities are raised to be prepared for flooding in low-lying regions of Bangladesh, or it means looking at our own emissions in hospital systems and figuring out how we can reduce them. If healthcare were a country globally, we'd be the 5th largest emitter of greenhouse gases. So we also have work to do to get our own house in order on the emissions front. And while we're doing that, we can be thinking about how to make our health systems resilient to the warming planet. We have to be thinking about expanding and securing access to healthy foods and clean drinking water in a climate change world. Agriculture is not my climate strong suit, but I do know that food security is greatly at risk as temperatures change, both because heat and rain are not no longer functioning in a predictable manner, meaning that we are seeing more droughts and more food insecurity. And we also have to be thoughtful that this food needs to be nutritious and ideally local, and also not high in emissions. So really thinking about making sure we can continue to feed everybody as the temperatures change and weather patterns change. One of the big concerns is that climate change is going to threaten the gains that we've made in health. And at the same time, investing in climate action now can save lives and money in the future. So very much aligned with Malaria No More's work. I've heard people from more than one country talk about malaria now being in highland regions where it never was before, because the mosquito is able to live in those places because the temperatures are warmer. And that puts a huge toll on the healthcare system. If people are, in a region that's had a climate disaster, it may reduce their ability to get to healthcare. It might mean they can't access their ARV supply. Climate change really puts health gains we've made at risk. But if we are thoughtful now, if we get ready and adapt, we can, I think, protect health from some of that change that is coming, and can even use responding to the climate crisis as a way to expand universal healthcare to proactively challenge or address some of the health challenges that we're facing. And I just to finally say that health actors have the opportunity to very powerfully amplify stories of those who are most impacted by climate change. Health speakers are one of the most trusted voices. And so we can share the stories of our patients and the stories of communities who are on the front lines of the climate crisis. We don't have to know all of the climate science to talk about the way that we see health needing to act on climate change. I'm getting a little bit of background, so if everyone again can just be really thoughtful about muting themselves, that would be great. All right, so with that, delving into COP and the UNFCCC, thanks for letting me lay the context there for a little bit. So what is this series of letters we keep saying? The UNFCCC is the UN Framework Convention on Climate Change. It came into force in 1994 and is now ratified by 198 countries. And the convention is basically an agreement. It's an agreement to keep working together on this massive global challenge. And to pull directly from what the UN says about this convention, they suggest that it's notable because the convention recognized that there was a problem and set a lofty but specific goal. It puts the onus on wealthy polluting countries to lead the action to address climate change, and also directs new funds to impacted countries. It keeps tabs on the problem in a really specific way, and also measures what's being done about it. And it kicks off formal consideration of adaptation to climate change. So previously, prior to the convention, the conversation was only about mitigation. But when the UNFCCC came into force, there was an agreement that a recognition that we weren't going to be able to mitigate enough to protect people's lives, and that some of the work needed to be planning for how we were going to adapt to this climate changed future. I'm going to drop a link in the chat, which is a little bit more information about the convention. That's where these points came from. And because the process of keeping to this agreement is ongoing, each year there are 2 sets of meetings that the UNFCCC holds. The first one each year is the subsidiary body meetings for the subsidiary body for scientific and technical advice and the subsidiary body for implementation. And those meetings are often briefly called the SBs. They're held in Bonn, Germany every year. So you may also hear people talk about Bonn. And they're happening in June. So they're coming up very shortly. My colleague Jess will be there if you're planning to go. And then the more well-known meeting is the COP. It's the conference of the parties. It happens every year. And there are also subsidiary body meetings happening during the COP. That's why the number for the SBs is higher than it is for the COP. I want to take us, I'm going to let the UNFCCC talk about the Paris Agreement in their own terms, because they do a very succinct job of it.
What is the Paris Agreement? The Paris Agreement is a legally binding international treaty on climate change to limit global warming to well below 2, preferably to 1.5 degrees Celsius compared to pre-industrial levels. This requires economic and social transformation to face the climate challenges now and moving into the future based on the best available science. The Paris Agreement works on a 5-year cycle of increasingly ambitious climate action. By 2020, countries communicate their plans known as nationally determined contributions. Countries communicate actions they will take to reduce their greenhouse gas emissions in order to reach the goals of the Paris Agreement. Countries also communicate actions they will take to build resilience to adapt to the impacts of rising temperatures. This may include information on adaptation and finance flows. The Paris Agreement also provides a framework for financial, technical, and capacity building support to those countries who need it. Starting in 2024, countries report transparently on actions taken. Collective progress under the Paris Agreement will be assessed through a global stocktake. This will lead to recommendations for countries to set more ambitious plans in the next round.
So you may remember that there was a lot of celebration when the Paris Agreement was signed in 2015. And just to highlight a few things that were shared in that video, the Paris Agreement was exciting because it was a legally binding agreement that I believe they said 196 parties signed on to. And there were a couple notable things. One of them was that it set this 1.5 goal for mitigation and set out an intention to set an equivalent goal on adaptation. That goal has been a little bit harder to develop because whereas the mitigation goal can be made global by looking at the average temperature change, it's more challenging to figure out what does it mean to have a global goal for our adaptation when adaptation looks so different in different places. In the Middle East, it's going to be very heat related, but in coastal areas that will be likely much more related to flooding. So there is work underway to determine what a good global goal on adaptation might be, and some of the conversation about that has suggested that perhaps we should be looking at health and well-being as part of that goal. The Paris Agreement also created the Green Climate Fund, which we'll talk about a little bit later. And the right to health is in the cover text, right in the Paris Agreement. So we have a place to be there. And we've worked each year to make sure that right to health is maintained in the agreements that are made in subsequent years. The Paris Agreement also initiated the first 5 years of the NDCs, which again, I'm going to talk about in a little bit more detail later on. Yeah, I'll talk in a little bit more detail later on. Let's leave NDCs there for the moment. I just want to note the importance of civil society at the COPs. So any agreement that has been reached, any gain that has been made to protect health from climate change and to protect people from climate change has come through a massive presence of civil society at the COP meetings. And both inside the COP and outside the COP, a huge amount of activism have kept people's rights and lives front and center. And so just a few examples, on the far left, you can see a photo from COP15 in Denmark, where you have people calling for rich countries to pay the climate debt. And that idea that those people who have been, those countries who have been benefiting from fossil fuel use and who are substantially wealthier because of it, and who will be less impacted by climate change, should be responsible for paying more to address climate change than those countries who haven't been polluting, who have fewer resources to respond to the climate crisis. It's called it's sometimes colloquially called the polluter pays principle, and that's only in the agreements and is a core part of the agreements because of civil society activism, both at home and at the COPs. There's also been a huge amount of advocacy from Indigenous peoples around the world in relation to the COPs. And this is a photo from a rally in Marrakesh in 2016. No, at COP15, my mistake. That will have been in 2010, I believe. And through that activism, the local communities and Indigenous peoples platform was created. And that means that each year there is a special process by which Indigenous people and local communities who are impacted by climate change share the ways their communities are being impacted in a 2-day process at the beginning of the COP, and then are able to share those findings with world leaders as they go ahead and make decisions. And finally, the picture on the right is a vigil that was held just this past year in Sharm el-Sheikh. A major focus of this vigil was calling for a loss and damage finance facility. That was a major call from civil society throughout the COP, and we did indeed see it happen. So even if you're not on a negotiating team, there's a really important place for all of us at some point in this process. And the other thing I'll say is that the civil society who's calling for climate action, often it involves and includes people who are going to be disproportionately impacted by climate change and who are least able to respond due to years of global power dynamics and extraction. And this includes small island states who we know are already flooding, lots of the global south because the climate is changing faster closer to the poles. Indigenous communities, both in the far north, but throughout the world, given that Indigenous people have since time immemorial lived and been in relationship with the land that is now changing rapidly. And also, of course, young people. And in recent years, health has really added our voice to this call, with the acknowledgement that protecting the health of our patients and the communities we care about requires us to get involved. So as Kelly noted, COP28 is an interesting and unique opportunity for health. And I think this is partially because the increasing impacts of climate change have made more and more health people aware of their role in addressing the climate crisis, and also in reverse, the climate community is really seeing health as an important stakeholder and health impacts as a key need to be addressed through the negotiations. And also we have a COP president or COP presidency country. So each year there's one country is responsible for holding the COP process. So they, at COP26, it was the UK, Alex Sharma was the president. And what that means is that the UK was responsible for planning the meeting, hosting the meeting, figuring out what were all the sort of themes and events and priorities going to be, and how were the discussions going to proceed. Similarly, last year, Egypt was in that role. They were very focused on, I think their theme was United for Implementation, so very focused on actions. And this year, the UAE is a country that has a history of being very invested in addressing global health challenges. And so they have come to the health community saying, you know, this year we really do want to make health a major focus. And as Kelly noted, we're getting a health day. I think one thing, and just last week there was this major announcement from the presidency, not only dedicating a day to health, but also really highlighting health issues. We're a little bit cautious at GCHA about how this is going to proceed, because as with anything, there's an opportunity for something good. Something good can be taken and co-opted by folks who have less than honorable intentions. I'm going to briefly share a story about COP26, where we were really excited to see countries starting to pick up health language that we developed to potentially put in some pieces of text. And when the first country picked it up, we thought, great, we're going to get this fantastic point about health in the major cover decision. And then Australia picked up the health language. And at that time, not to broadly knock Australia, but at that time, Australia had really been stalling on a lot of the mitigation asks that were coming from climate impacted countries. And just see them take the health language and champion that as sort of a way to turn attention away from the ways they've been stopping progress on things that were needed actually to protect health was concerning to us. And so as more people come to understand health as a useful lens by which to talk about climate change, I think we all need to just have some care and awareness to make sure health isn't being used to make arguments that are actually, in the long run, detrimental to health. So for example, we did see Shell a couple months ago say, you know, the only way to protect health is to continue and expand fossil fuels. And particularly because of the air pollution impacts, but also the extraction impacts and because of the warming, that's just objectively not true. So just wanting to be cautious, even as we're so excited that the spotlight on health is a bit of a fine line. So I've now been talking for a very long time. I'm going to pause and take questions if anybody has them. So you're welcome to raise your hand or put a question in the chat, or Milena, if we're seeing any questions that I missed. Yeah, Allison, please.
Sorry, struggling with technology. I think we're really excited about COP, and I appreciate your final point about the fine line, like making it is an important time for us. How do we make sure that health isn't, frankly, being used as a kind of fig leaf? And within the process, as we come together as a health community, collectively, how do we take that step back? Or are there sort of, maybe we'll get into this and sort of what happens at COP, but we're thinking seriously about it, quite a nice delegation going to COP, but cognizant that if this starts to be used in ways that just aren't ethical, what are our stopgaps there? And I hope we'll have an opportunity to talk a little bit about that as a real concern. Thank you.
Thanks so much. That's such a great question, and I definitely think it's something that we're really thinking about, and that is part of the reason that we're starting these sessions earlier than usual. I think I can say a little bit now, and then I'll say a little bit more when we get into the negotiations, but I think being really clear on which negotiating points or which actions do really benefit health, and which of them potentially put health at risk will be important, even if that's in the long run. So it's GCHA is trying to develop a this is what health protective actions at COP would look like. This is not what health protective actions at COP would look like. I think lots of it, partially it may be perhaps because GCHA has come from a mitigation space, but people are pushing very, very hard to connect to both extract gas from the African continent and to make the case that gas is so much better for people's health than burning charcoal, that we must connect people around the world to gas stoves. And that's concerning for a few reasons. One of them being that methane is often released when gas is extracted, and methane is a very potent greenhouse gas with a much higher warming potential than CO2. But also, if you're in the US, I know there is increasing evidence that gas is not risk-free for respiratory health either. And so I think it's acknowledging that, yes, people deserve to be connected to energy, to be able to heat their homes, to be able to cool their homes, to be able to have their basic needs met. But it's how do we do that in a way that is not a partial measure? But yeah, definitely, I don't have a full answer, but partially because I think it's something we're all grappling with and we're going to need to keep talking about together as we go ahead this year. Okay, I'm going to take a moment or a couple slides to talk about how the big international processes translate nationally. And that's primarily through two things that are mostly talked about in acronyms, the NDCs and the NAPs. So the NDCs are nationally determined contributions. They're the plan that every country has to submit to detail how they will address climate change. So they're renewed every 5 years. And the next deadline is 2025. So we had the first phase of NDCs was the Paris Agreement through to 2020. For obvious reasons, that was delayed a little bit. And then the next phase is 2020 to 2025. The current commitments, like what countries committed to do to reduce their own emissions and also to adapt, are insufficient to keep warming below 1.5, which is concerning. And so as we get closer to 2025 and countries are redrafting their plans, there is a place to be pushing nationally to have more ambitious, nationally determined contributions to make our plans to address the climate crisis stronger. Some NDCs include health, but as we're going to see from an evaluation my colleague Jess did, including health isn't enough to protect health, sort of related to the points we were just talking about. So this is in 2021, GCHA released a review of NDCs for how well they included health. Jess is currently doing an update of that process that I believe will be released at the end of the month. But we just looked at whether health was mentioned in the NDCs of a country. So did they talk about health impacts, health and adaptation, health co-benefits? So what health gains were being made from addressing climate change, whether health was mentioned in economics or financing. There was some space for bonus points. And then we used data from Climate Tracker to evaluate whether the plans were ambitious enough to meet that Paris Agreement target and protect health in that way. So you can see a country like Costa Rica, for example, had a lot of mentions of health and is scoring quite high. And countries like, I believe Canada was pretty low, referencing that because that's where I live. And to this point about health inclusion doesn't necessarily mean something is ambitious enough to protect health. We're just going to briefly look at Argentina, not to shade Argentina, but just because it's a good example where you can see they mentioned their health, they got a 2, they mentioned health impacts in their NDC and had plans for health in adaptation and looked at co-benefits even and said a little bit about financing. But their plans from the mitigation side were not ambitious enough to keep warming below even 2 degrees. And so it's this dual push of like, yes, please, as you make your plan to address climate change, please include health and please be thinking about the health sector, but please also be ambitious enough to globally keep us in a safe and healthy temperature. There's also national adaptation plans, the NAPs, and they are a way that a country identifies medium and long-term adaptation needs. Some NAPs include health in them right away. Some countries have actually created specific health NAPs. And all countries are required to submit NDCs, but they don't all have to include adaptation plans. So if you're working at a country level, it's just valuable to ask whether your country is creating a national adaptation plan and where is health in that conversation. I want to highlight someone who was at the Forecasting Healthy Futures event and actually was on our last COP orientation session, Hendrix Ngodi from Malawi. He is the environmental health officer for the Ministry of Health. The thing I have heard him say over and over is how important it is for health actors to be involved in drafting the NDCs and drafting the health, the national adaptation plans. Both because it's an opportunity to get to meet the other people in who are working to address climate change in the transportation and energy sectors, but also because if you can get health in when those plans are being written, the whole plan will be more likely to include and measures that will protect people's health. And somebody asked him on the last call. Someone asked Hendrix on the last call, how do you make sure that health is included in your NDC? And Hendrix's answer was, you just push really hard. You just don't take no for an answer. And you as the health ministry technical staff work really hard to get in the door and to build relationships with the environment ministry and the energy ministry to make sure that the measures that are in the NDC are going to protect health. And so if you happen to run into Hendrix, definitely pick his brain about his experience working on his country's NDC. And you can see that yielded benefits in that health impacts and health and adaptation were considered as when Malawi put together its last NDC. I saw a question about who they're submitted to and how they're evaluated. So formally, the NDCs are just submitted to the UNFCCC. And then civil society groups like ourselves evaluate them after they have been submitted. I don't believe that the UNFCCC sort of goes through and says, yeah, this plan is a good plan and this plan is a bad plan. It's more, Climate Action Tracker looks at every country's ambition and says, yes, if we did this, that would be enough reduction of emissions to keep us to the target. And for us, we looked, went through and looked for health language and rated their health language, but I don't believe that there's a formal evaluation process from the UNFCCC. There's just an ongoing submission process. Are there other questions about the national programs? So either the NDCs or the national adaptation plans? Okay. Oh yeah, Bamji, go ahead.
Hi, my name is Bamiji. I'm from Nigeria. My question is surrounding how do we ensure a just transition for low-income countries and middle-income countries in regarding compliance to their national adaptation plan, because countries like Nigeria, South Africa, Congo, countries that are still heavily mining, and they rely on these mining activities mostly to generate economy, to generate a source of revenue for their economy. So if you're not talking about transitioning to green energy, reducing carbon imprint and all those things, all these countries, we come out with the argument that most of the first countries today in the world, they generated or they power their industry through from mining activities like coal and hydrocarbons. So why are they saying that we should stop now? We know that there's climate change. We know hydrocarbon is contributing majorly to climate change. But we need these mining activities to generate economy, to generate revenue for our own economy. So why should we be the one to stop now? So my question in particular is, how do we ensure a just transition to allow these countries to, I don't know how to put it, but just to have enough to power their own economy as well, while at the same time reducing their carbon imprint? Thank you.
Thanks so much. I mean, I think that is part of the big question and part of the reason it's a huge point of debate and effort each year at the COP is that brings back also to the polluter pays principle, where we'll talk about it a little bit more when it comes to financing, but countries who have, as you said, made money from polluting the world and exploiting fossil fuels are being asked to pay much more to support countries to transition their economies, and to both fund adaptation and also to fund mitigation efforts. I think one of the I understand economies that are based on fossil fuels, and I mean that is true in Canada as well. That there people, oil companies and people in the finance sector make a really strong case that we need to continue extracting fossil fuels in order to have a healthy economy. I think the thing that gets missed there is there is real health risk by continuing to use fossil fuels. So in thinking about South Africa, one of our partners is working quite closely with coal mining communities, and the respiratory impacts of coal mining are disastrous for coal miners and also for the families and the communities who live nearby and are breathing coal dust every day. And the same is true about Indigenous communities in northern Canada who have been on the front lines of oil extraction. And in my understanding, the same is also true for communities in Nigeria who've been near oil extraction. I've never been, but my understanding is the health of people who are close to extraction sites is not being protected anywhere in the world. And so I think, and I very briefly heard a story recently about a young boy who was featured in a BBC documentary called Under Poisoned Skies, who's from Iraq. He was 21, and he grew up beside an oil extraction space in Iraq. And he was a very vocal activist because he had had cancer. I was on this call where we were talking about hearing from him and having him speak places. And then shortly after, the documentarian got back to us and said, you know, his leukemia resurfaced and he's passed away. And the number of children in that part of the world who have this leukemia is unusual, and people so unusual that it makes you wonder why that is. And it is a type of leukemia that is tied to benzene, and benzene is often in the air near oil extraction sites. So I think for sure wealthy countries who've benefited from pollution need to be paying and supporting a just transition, as you've talked about. But I think part of my belief in in you know, getting away from oil is partially because extraction is not without cost. It's just that, like, the economy gets to, or the economy gets to make money off of these fossil fuels, and that is great. But there are families who are paying the cost in their health. Sorry, that was a bit of a longer detour than I intended. John.
Yeah, thanks, Jen. I'm very conscious of time, but you may be coming to this, but I suspect from many people on this call to sort of this point about the sort of the balance between the equity of the situation around where health damage is being felt and the role in causing climate change being a disconnect that is clear to everybody, I think. And just talking about the NDCs, I suppose my question is, where are the global commitments sort of held? So NDCs, it sounds like, hold national commitments to contribute to climate mitigation and adaptation. I mean, I find in that equity conversation, it's slightly odd that Malawi has a fantastic plan to do health adaptation when they didn't cause the problems in the first place. But anyway, but where are the global commitments to that adaptation and the sort of to resolve the inequity held, and where are they, articulated, I guess, if they're not in the NDCs, which I'm assuming they're not?
Yeah, that's a great question. Those are held sort of through the Paris Agreement. So countries, I'll speak to it a little bit later, but in the Paris Agreement, those polluting nations committed to, I believe it's $1 billion a year. It was meant to be $1 billion a year to the Green Climate Fund, starting in 2015, and that countries would, who had been polluting, would contribute to the Green Climate Fund, and then countries who were impacted by climate change, who had not been polluting, could put in applications for adaptation and mitigation projects to the Green Climate Fund to address those issues. And so partially my understanding of how that works with the NDCs, or the national adaptation plans, is that Malawi lays out what they're going to need to do to adapt to the climate crisis, and then they can go to the Green Climate Fund to apply for money to implement those projects. So the big national agreements to keep warming to 1.5 degrees and to have a global goal on adaptation, those are sort of the overarching international commitments, and then underneath that there are other agreements for funding, which is maybe a partial answer, and I may answer further in a couple of other slides, but it's a great question. Okay, so moving on briefly, when you get to a COP, now we're just going to do COP for 25 minutes. When you get to a COP, there's two zones broadly. There's the blue zone, where you need accreditation, you need a badge, either that you have acquired because your organization has gotten accreditation from the UNFCCC, and then you apply for badges. And then once you get a badge, you can get into the blue zone and have access to negotiations and side events and be part of the official business. There's also every year a green zone that is public. You still need a pass, but it's much more accessible. And it's meant to be sort of a learning opportunity for the city who is hosting the COP. So lots of school groups access the green zone, and as well as the general public. There's also a huge, generally, or I shouldn't say that, depending on the country and how much tolerance they have for activism, there's often a lot going on outside of the COP that is not in the blue zone or the green zone. So the New York Times hosts, you know, a speaker series. There's rallies and protests in the streets. There's other meetups and sessions happening. There's online events. The last couple of years, the People's Health Movement has hosted an online health tribunal. So there's lots going on. The most of what we're about to talk about now happens in the blue zone. So it's things that you would need accreditation for. So there's sort of four major buckets of things that happen at a COP. There's negotiations, there's program announcements, there's events, and then there's press and communications. And so we're going to start with negotiations, which are the kind of like the main event of the COP. National, each year every country sends a negotiating team. They vary in size depending on a country's resources. The team could be very large or very small. And through the whole 2 weeks, there are many, many, many negotiation streams ongoing. And so one of the challenges is that a country with the resources to only send 2 people will have those 2 people running around trying to be in all the rooms at once. And a big country with lots of resources can have one person following adaptation and one person following loss and damage and one person following the gender overarching goal. But there's also negotiating blocks to try to compensate for that. So some of the blocks overlap and they include G77 plus China, who each block, if you were to watch negotiations, the block will have one speaker at COP27. The speaker from G77 and China was from Pakistan. She was very fierce and really held the line on a loss and damage finance facility. There's also the Alliance of Small Island States. The African group of negotiators often speaks as a bloc. The European Union speaks as a bloc. And that is one way to mean that, you know, people who've agreed to a shared interest are listening to the various negotiating streams. This graphic is from COP27. And a negotiator from Panama posted it. And I just think it captures so much what the negotiating teams are doing at a COP. They are working really, really hard to try to get to consensus documents on each of the streams, and then eventually as well about a cover text. And we as civil society are often trying to connect with them when they're getting increasingly frazzled throughout the week. So lots of the work to get negotiating teams ready to negotiate and stand for decisions that would protect health can happen and should happen in the months leading up to COP. So I know there's a group of health people who are going to Bonn, and part of what they'll be doing is sharing the health case with negotiators at Bonn. But also there's space to be talking to your national government, your national negotiating team in the months before COP. There's a number of major negotiating tracks. We've talked about a few of them. So mitigation is all about reducing emissions. Adaptation is how will we prepare for the warming that is already happening, that will happen even as we continue to reduce emissions. The loss and damage track is how are we going to fund our response to the impacts that we haven't been able to prevent because of mitigation or adaptation. Finance is those agreements around who's going to pay for what by when. Agriculture and food is a major track. So how are we going to manage food production in the climate change future? The global stocktake is looks at measuring how our progress it also runs every 5 years in between the NDCs. So you kind of have the NDCs and then you have the global stocktake, and global stocktake is using existing measures to try to figure out how are we doing on meeting our Paris Agreement. And then in the second week, there's always a big negotiation about the cover text. So that's the big document that you might have heard about, the Glasgow Pact, the Paris Agreement. I don't remember what it was called from Sharm el-Sheikh, but it lays out everything that's been negotiated and agreed upon for the 2 weeks, and often has key points about what the parties have come to. So health can be a tool to call for ambitious climate action, and the health community has been increasingly joining civil society to advocate for ambitious action in adaptation and mitigation, whether or not we get health listed in the text like verbatim. So at COP27, GCHA coordinated party outreach where people were going and talking to negotiators, and also negotiation tracking. So people went in and sat in negotiating rooms and listened to what was being said, and then could say, hey, this country sounds like they actually could really are really championing a loss and damage facility. Do we want to go talk to them and share some additional health language with them that might strengthen their case? I think, just to flag, one of the reasons I think it is important to have health, civil society, and civil society more broadly in the room is there are, as far as I can remember, there are more representatives from the fossil fuel industry at COP than there are from any country's delegation. So it's often in the hundreds. There's people want to keep their jobs. People are again fighting, trying to make money for their economies that are based on fossil fuel extraction. That is very understandable. And also having that many people who are invested in continuing to extract and use fossil fuels in the room is part of the way that we have continued to not get ambitious mitigation. Part of the way that countries like Canada, who have made a huge amount of money from extracting fossil fuels, have continued to be able to extract our fossil fuels at the expense of the rest of the planet, because there's interests who are also at the negotiating rooms, also listening to negotiations, also talking to negotiators, asking them to weaken the language. So health, I think, has a really important role to play in joining the conversation. I'll briefly run through. So at COP27, we pulled together some policy points. And if you are interested in getting more involved in the policy process, Jess has been running a series of meetings that for people who are interested in developing policy as we get closer to the Bonn meetings. But we'll reinitiate those meetings in September. So if you are interested in thinking about what the health community's policy asks broadly should be, you can join those conversations to help shape the asks. They'll likely be pretty similar to these asks from last year. And then that is what the people who are meeting with parties from the health sector are going in to talk to governments about. So they're quite general. We're not trying to be authoritarian or tell you what to do. They're just we felt that it would be helpful to have a broad consensus document of things negotiators could ask for that would protect health. And they were created collaboratively last year and will be adapted collaboratively this year. Milena, if it's possible for you to find the form to sign up to join the policy group, that would be fantastic. So the way to join those policy conversations is you sign up using a form, and then Jess will circle back to you and invite you to those meetings. So these are our policy asks on adaptation and mitigation. Last year, things that'll be pretty familiar to you by now. So as we develop a global goal on adaptation, making sure there's health metrics in there, that the global goal on adaptation needs to be a balance of quantitative and qualitative measures. Ideally, it's going to look at something that's already being measured. Ideally, it's relevant globally and locally. Health can echo and amplify what other communities are calling for in relation to this goal. With regard to mitigation, making sure we're phasing out fossil fuels and fossil fuel subsidies. Last year, we were quite vocal in calling for a loss and damage finance facility, and we got that, which was very exciting. enforcing this call for wealthy countries to deliver on the, I was wrong, the $100 billion goal, and prioritizing funding interventions that have health co-benefits, and including health in the global stocktake process. Cover text. So again, this is like the big headline making text that you hear about every year. At COP26, the first draft of the cover text called for a phase out of fossil fuel subsidies, and we were very excited because if we're not, at the very least, spending a lot of tax dollars supporting people to continue damaging the health of the population, seems like a poor public health move. But by the end of the agreement, that had been weakened to inefficient subsidies. And similarly, the call of a phase out for phasing out coal had been changed to phasing out only unabated coal. So that just means putting smokestacks to make the coal burning cleaner, but doesn't actually reduce emissions in a super major way. And similarly, last year, when the first draft of the cover text came out, it wasn't strong, and much of the rights language had been taken out. So the health community really pivoted from our asks that we'd been looking at and went back to amplifying calls from other communities, but also trying to protect rights language, not just the right to health, but those rights that we know are needed to protect health more broadly. And also continued to add our voices to the call for a loss and damage finance facility. So the other things that are going on at COP are program announcements. These also often make the news. And a really good example is at COP26, the WHO, in collaboration with the UK government, who was the presidency at that time, announced the Alliance for Action on Climate Change and Health, ATACH, which is countries working together to make their health systems more climate resilient and also lowering their country's emissions. And it's a collaboration where the WHO is providing technical advice and support, quality assurance, and looking for ways to increase financing to help countries make their health systems ready. So this wasn't, the reason it's an announcement and not a negotiation is it wasn't agreed, it was voluntary sign on by the parties. The parties didn't have a debate about whether they were gonna shift their health systems. WHO came out with this initiative and said, hey, we want to support you to transition your health systems to make sure they are resilient and low emission. And the COP presidency of that time supported them to do that. And I think we're likely to see many more health related announcements at this COP than we have before. There's also a huge number of events and meetings that happen inside the blue zone at COP, also outside, but I'm going to just talk about those inside the blue zone. So you have this really unique opportunity where there are ministers and technical staff and civil society and frontline communities all in the same space. And so on the far left, there's a photo of a meeting that was health ministry staff from the African continent that AMREF hosted. All those people had come to the COP, and so getting them in a room to discuss what they were doing in country is a really unique time to do that. There are, on the far right, is a high-level event on health and the race to zero that was hosted by the COP presidency. So and then there's official side events where you apply using the UNFCCC platform to have an official side event that is in like one of the major rooms that's on the formal agenda. If the process to get an official side event is a bit complex, I'm not going to speak to it now, but if you have questions, if you have questions, you can put them in the chat and or email us, because there's just I'm also not. Yeah, it's a bit of a multi-step process of the official side events, and there are some benefits to having them. I'm not sure that the benefits are worth the process, but I will leave that up to you. There's also pavilion events. So the pavilions are like several hundred, or it's probably 150 rooms. Some of them are led and hosted by countries. Some of them are led by the UN Environment Program, or there's a resilience hub. Last year there was a children and youth pavilion. And each of those pavilions runs programming and events and is a space where people are talking about climate change from whatever their perspective is. The last 2 years, there has been a health pavilion. That's the middle photo is at the health pavilion in at COP27, and that has been a great meeting point for the health sector. And also, as we go ahead this year, we're really encouraging people to try to get health events at other pavilions. So if you're based in a country, reaching out to your government or your country and your COP, the folks who are going to COP, to ask if your country will have a pavilion, figuring out what the process is to apply to have a health event at that pavilion is one way to bring the health lens and the health conversation to places other than just the WHO pavilion, because we don't want to be talking to ourselves. Unfortunately, there's not a centralized process to apply for pavilion events. You have to go to your country to figure out, will they have a pavilion this year? And similarly, if you were interested in hosting something at the Resilience Hub, for example, because that's your work, the way to do that and figure out the process is like Google Resilience Hub and look around to see if you can find an application process. They usually open in August. We will send around the application for the WHO pavilion because that's the one that we most easily have access to. But one of the best ways I have found so far to figure out what pavilions will be at COP is to go back and look at who hosted a pavilion at COP27 and then find a few that you're interested in and then sort of check back on a regular-ish basis to figure out when that application process opens. And I'm sorry that it's not more straightforward. Another thing to note, I know we said there's a huge amount of civil society and frontline communities and Indigenous folks and the private sector at COP. Last year there were 35,000 people. It's projected to be double this year. And it is a unique opportunity to connect with national ministers to build relationships that you can keep going when you go back home. And I think we have this unique opportunity this year where health ministers and health ministry staff are likely to be there because the COP presidency is hosting interministerial dialogue with health ministers. So I think that will be a really unique point for health actors who are working on climate change to talk to their health ministers and health ministry staff about what we collaboratively are going to be doing to protect health from climate change. And finally, there's the 2 weeks around COP are a time when the international press is paying a ton of attention to climate change. So whether you are in the building or at home, this is actually a great time to be telling a climate change story in your local media. In the blue zone, there's a whole press area where there are journalists, and it is an opportunity where you can walk over and say, hey, do you want to tell this story? So just something to think about. Again, you don't have to go to COP to be talking about climate change in the 2 weeks that it's happening. The one other thing I'll say is I think that there is a question. Sometimes people ask, like, is it worth it to go to COP? And I am not sure that I'm not sure that I would say one way or another. If you are coming this year to the UAE, I would say that it's really only worth it to come to Dubai if you can get a blue zone badge. Partially that is because I anticipate it will be quite expensive. Travel is expensive. And if you can't get into the negotiation rooms and you can't get into the space where all the pavilions are, I have known people who came to Sharm el-Sheikh last year and couldn't get into the venue. And then it can be quite frustrating because so much of what's going on is in the blue zone. So I would say it may not be worth your money if you cannot, unless you have a big team who's going and you're going as a support person for people who are in the venue. I wouldn't go if you don't have a badge, partially also because it can be tricky. It's rare that you can get a badge if you didn't have one before kind of September. And there is lots that can be done without going to COP. So either contacting local media, working on your NDCs, making hay regionally or nationally. There's lots that can be done around climate that doesn't require you to be in the COP venue. I also think that there's this year this opportunity to in advance be talking to health ministers about climate change. So because they're coming to COP, so that there's prep work to be done if you don't plan on coming. Okay, so finance. Oh, there we go. So overall, unsurprisingly, the climate finance is falling short. So countries are meant to be putting in $100 billion US every year, and we have routinely fallen short of that target. And there's more that we can do broadly as civil society to push countries to live up to their climate finance promises. Climate finance project, like the money that has been taken out of the Green Climate Fund, which is the big one that came out of the Paris Agreement, has largely been weighted towards mitigation projects. Only in 2021, only 25% was going to adaptation projects. And that balance is supposed to be 50-50. Even within that, health has been under prioritized in both mitigation and climate adaptation. And we've heard that that's partially because health hasn't been aware that this funding exists. It's partially because the Green Climate Funds are often actually much bigger amounts of money. They're like to rebuild a city or to redo your water system or to redo your energy system. They're much bigger pots of money than health is used to accessing. And also health actors don't know the process to get money out of the fund. I think that that's changing. Again, in Malawi, Save the Children worked with the Malawian government to apply for funding that was linked to health. And I also think that there's ways that health could be more involved in other proposals. So again, if a water proposal is going forward, health actors could be part of that proposal to the Green Climate Fund. And recently, researchers pulled together, let me just drop this link in the chat. Naomi Baylor and Marco Schaeferhoff looked at health and climate finance and made the case that not only should health be trying to get money for health projects out of climate financing, but that health could be funding climate projects. And their full report is there. I'm going to pause briefly here and turn to Kelly to share a little bit about the work that Financing Healthy Futures has been, or Forecasting Healthy Futures has been doing on finance.
Financing Healthy Futures works too, though. Thanks, Jen. I mean, you covered the major points. We have inadequate financing at present for climate investments and initiatives in general. Only 25% to a third is in the adaptation space. That may be an appropriate balance, but of that, just 2%, or as you said, 0.5% of the total climate financing is currently directed to health-specific initiatives, investments, and we think that needs to change. In addition to sort of country commitments through the Green Climate Fund and other funds like it, we have, a whole array of banks, multilateral development banks, who have pretty aggressive targets to increase the share of their lending, financing, and development assistance that goes to the climate space. So it's targets from the World Bank and Asia Development Bank at like 75% of their total financing by 2030. So we are going to see an influx of resources and financing solutions available. It will likely still be inadequate, but Forecasting Healthy Futures and through our Health Finance Coalition in partnership with the Clinton Health Access Initiative are working pretty aggressively to increase the proportion of those investments that are directed to health interventions, both to investments in the health sector that improve climate resilience and or have a mitigating impact on emissions and our mitigation targets, but also to existing proven scalable interventions that can save lives immediately and that respond to the immediate threats of global warming where we are today. So in other words, major inoculation campaigns in high-risk areas for flood to guard against upticks in cholera, dengue, malaria, but also initiatives that look at providing clean drinking water following extreme weather events and in response to other factors associated with low onset warming health conditions. So we have, we're heading up the Climate Health Task Force for the COP28 Steering Committee and really working to drive investments in this area. The first thing that we believe is needed is a common investment framework for all lenders and donors to use to assess investments for the degree to which they respond to climate threats to health, and hopefully also have mitigating effect as well. So if we can come up with a framework that's generally acceptable, it'll be that much easier to shepherd resources to the right places. Then we're also working to identify some of these, what we're calling best buys in climate health, these major interventions that can save lives today, that are universal in their application and can be scalable and can absorb the kind of dollar investments that we're talking about. And we'll be championing those interventions themselves. And at the same time, working to develop a catalytic fund that can be used to champion climate health investments and can be used in blended finance mechanisms and instruments to really unlock bigger public spending in this area. So we're doing a number of things in the climate finance space along those lines, and you'll start to see more from us on that front via email and social media. And we're hosting a small event in Geneva alongside the World Health Assembly, and again, working very closely with the COP28 team on all of that.
That's really awesome. Thanks so much for sharing, Kelly. It's also, again, GCHA has less experience and expertise in the finance space, so it's really exciting to have some of the big global health power players who have experience mobilizing funds for health challenges, taking such leadership in the space. So to close out, I want to just bring us back to the those priority actions that we talked about at the beginning, and relate them back to what we've been talking about with regard to COP. So when we say health actors should be planning for a climate safe future, one way to do that in the COP space is getting involved in the negotiations, figuring out how to connect with those who are working on your NDC or your NAP, and making sure health is very much a part of those plans. If the fossil fuel phase out work fits very much into the mitigation negotiations stream. When we think about transforming health systems at COP, that really lives under the attach work. And I should also say there is an attach if you'll be at World Health Assembly. It may be by invitation only, but the UK government is hosting a session that's focused on attach on Monday. I'm realizing this slide is slightly shifted where, but as Kelly just noted, in investing early in initiatives that protect health can reduce the massive impacts of climate disaster, and putting, as with everything, dealing with the problem up front now, putting in the money now will save lives and money later. And we're seeing that's the case for mobilizing financing, both through the official Green Climate Fund and also through some of the innovative and new channels that Kelly just mentioned. So that's it from me. I can stay for about like another. I can stay past the top of the hour if you have questions that I didn't get to, but I'm also willing to take. I can start taking questions now, and I can stay. Is what I'm trying to say. Yeah, Sylvia.
Yes, thanks so much. That was really a very, very useful briefing. I have maybe a question. I mean, at a certain point, you spoke about the fact that obviously there is less historical, let's say, development of the adaptation type of topics and objectives and so on, and that you are preparing an adaptation document or some kind of a policy briefing on adaptation. Is it correct?
We're not creating the document on adaptation. The UNFCCC is trying this year to get the agreement on what the goal for adaptation will be. So something that's equal to that 1.5, where like everybody has agreed to this is what we're trying to do on adaptation. So that's I think what I was talking about. But in terms of our policy, we are the policy asks that I shared were part of a much longer document that had more information and briefing about adaptation. So we will be updating those this year. And you could certainly look at what exists from last year.
Okay, yeah, right. Now that would be very useful because actually we come from very different experiences. In our case, I'm from Medicines for Malaria Venture, which is a product development partnership. So we are coming from R&D, and we have an interest actually in contributing, possibly also from this perspective, wherever it is possible, in the context of looking at climate change and health and malaria, particularly for us. The other question was about. Is this group actually, because again, I mean, the health community is relatively new in this kind of context and probably quite fragmented. So the question is, this kind of group, this kind of workshop, and this is a question also to Kelly, are a sort of an initial step also in trying to bring together some kind of a network actually to discuss climate change, adaptation, or mitigation as relates to COP and this agenda.
Yeah, I'll answer and then I'll turn it to Kelly. So what GCHA has done is we've functioned as the convener of the health community at COP. So we generally run a few of these sessions right before the COP in the fall. We often run a session that we call the Roundup, where we invite health organizations who are going to COP to share their plans in a really rapid fire session where everybody talks about what they're doing. And then we also at COP convene the lunchtime policy meetups so that people who are meeting with negotiators can be a bit more organized. And then with the Climate and Health Foundation, we hosted a reception last year where everybody who was working on health at COP was invited to come meet each other, get to know a little bit more about what others were doing. And we believe folks from Climate and Health Foundation are on this call, and we're planning to similarly host a reception this year to continue to have the health sector be coordinated. Again, we're not interested in being like really authoritarian, but we are wanting people to have the chance to learn from each other. Kelly, do you want to say anything more about the work that Forecasting Healthy Futures is doing?
Yeah, we're also not aiming to be prescriptive, really, and we support GCHA being the chief sort of convening on advocacy and partnership. Forecasting Healthy Futures focuses a little bit more on the innovation side of things, so really trying to increasingly connect people who are working on the technical side of how exactly to build climate resilient health systems and what interventions and use of data and AI can be most impactful in the face of climate threats. We started as a small consortium of partners working in that field, including tech companies who are using data and AI systems in innovative ways, but we're growing. So we've been working first to just convene, groups of like-minded innovators in the space, but we are planning to expand our formal consortium. So I encourage you to go to our website, send us a note, info@forecastinghealthyfutures.org. You can also just reach out so that we can talk about ways to get folks better connected and more involved.
Thanks again for your question, Sylvia. And just because folks are hopping off, I just wanted to thank you all so much for joining us and for your interest and for joining this conversation and this effort, because I do really think we will get stronger, better action to address climate change if health actors are in the room. So it's exciting to see you all here. Again, I can stay a little bit longer if folks have questions, but if you want to go and get on with your day, you're welcome to do that also.
As I sign off, Jen, I just want to thank you for going through this so many times with the same enthusiasm and attention to detail. It's really admirable, and I know it's super valuable to the community. Thank you so much.
Thank you so much for the opportunity.